Hey everybody, we're here at the 2022 CrossFit Games in Madison, Wisconsin. It's CrossFit Health. My name is Mike Giardina, and we're here with Dr. Rodrigo Jezbik.
Yeah.
Did I say that right?
Yeah,
All
right.
Who is a doctor, a cardiologist
Yes.
in Brazil. And he's going to be on the panel with us a little bit later today talking about how we can bridge the gap between healthcare and fitness. So it's essentially a little bit we're going to talk about today, but more about his experience and how he's been able to do that. But before we get into that, Dr. Rodrigo, can you provide us with just a little bit of background on what you do? Like what is your profession, what you do in Brazil?
Yeah. Thank you for inviting
Of course.
me,
Yeah,
Mike.
thank you for being here.
I'm very, very happy to be here. And in Brazil, I am a cardiologist. I do 20 years that I've become a professional doctor, a medical. And in the mornings, I'm a chief of ICU with very critical patients. And in the afternoon, I'm a cardiologist and I work with people, with patients in my medicine office with cardiologists.
Okay.
But first, 7 o'clock a.m. I do CrossFit.
Yeah.
This is my medicine because I have high blood pressures
Yeah.
and had high blood pressure, and nowadays I have no more because CrossFit saved my life.
Yeah, tell us a little bit more about that experience, if you could.
Yeah, about 7 years ago, I discovered that I had high blood pressures. And at that time, I was sedentarism and I didn't eat very well.
Yeah.
And my family, I have the genetics
Sure.
about this disease. And my wife, she does CrossFit and she saved my life so many times. And this time she saved my life again and she introduced me CrossFit. And I started and I loved it. It was patient at the first time.
Yeah.
And I didn't only do CrossFit, but I started and I wanted to learn about CrossFit and study CrossFit. So I took my level 1, and after my level 1, everything changed in my life. The page 21, as I ever say to everybody,
Oh, yeah.
that page saved my life. I had that page in my medical office,
Yep.
where now I believe that I am a better doctor because, as we know, doctors get people sick and try to make them health.
Yep.
And CrossFit showed me that I could make people fitness, as we say, better than health.
Right.
And this is what I try to do, and I do it every day in my medical office. In Brazil, we can't coach CrossFit as a doctor.
Yep.
So my work is in my medicine office to take people and show them that they can be better than health.
Sure.
I don't only speak about CrossFit. I think that we need to study
Yeah.
CrossFit. And
As physicians, you study
yes,
CrossFit?
we
Yeah.
need to study CrossFit. I did my level 1 and I have 9 courses of CrossFit. And I try to do this. And
Sure.
in Brazil, as we can't coach CrossFit, but we can say about CrossFit.
Sure.
And many doctors don't know. I think that the biggest problem is education. So what I try to do in Brazil is to educate my colleagues, my health professionals, and try to show them with lectures, with scientific articles that
Sure.
it can be better. And medicine isn't only the one thing that we can do to our patients. And I try to do this in Brazil in affiliates. I go in many boxes in Brazil to share this message that I learned in my level 1, and I try to do this every day with my patients. And now I try to say in the other community that we have in Brazil, health professionals, coaches, and other professionals that share this message that CrossFit can, and I truly believe that can change and save lives.
That's awesome. So what you do as a cardiologist and as a physician is based on let's just call them rules in Brazil. You can't teach movement, but what you can do is you can go into affiliates or you can talk to some of your colleagues and essentially you're a liaison for both, right? So you can go talk to physicians, other colleagues, and say, hey, this is what CrossFit's all about.
Yeah.
Here's how it can be beneficial to improving health. But then you can go into affiliates and then talk about how, maybe affiliates or coaches can work together with physicians to improve health as well. Is that kind of how you're bringing the two sides together?
Yes, yes, and then it's we are trying to do and make it better in Brazil.
Yeah.
I think it's in the start, we are starting doing this, but I think this is the way to bridge the gap with us health professionals and coaches and affiliates and our community, the principally.
What are some of the challenges that you've come across in Brazil when trying to educate colleagues about CrossFit? Are there some misconceptions that they have when they think about CrossFit? Like, what are their thoughts initially about CrossFit?
Yeah. I think that don't only doctors think like this, because nowadays, if you, as we are talking about, if you type in Google now, it will show CrossFit games, and it's amazing, it's fantastic, but it is not for everybody as my patients.
Right.
So I have a old woman, obesity and high blood pressure, and if she saw CrossFit games, she will say, no, it's not for me. And doctors think about it.
Right.
And I think that the principal thing that we need to do, and so many other doctors in Brazil that do the same, it's to show to everybody that anyone can do CrossFit.
Absolutely.
And I say for everybody that if you are a person who have many diseases, you are the people who will have more benefits to do CrossFit. Not athletes need to do CrossFit. Okay, they can do to improve themselves and their sport. Sure. But sport is here in the top of things. I think, and I truly believe, and we show that in articles in scientific, it's not what I think, it's what is wrote, that if we have somebody with many diseases, this kind of people has more benefit to start and do CrossFit to their lives.
It's an interesting paradox. The people who need CrossFit the most are the ones that think it's not for them, right? And then, not to say that athletes and people in sport don't need it, but they're more motivated to start doing CrossFit to improve their sport, and they probably need it a little bit less than somebody who has some type of health conditions or obesity. So we really need to work on kind of changing that message, right? And improving some of those misconceptions and kind of changing the perception of what CrossFit is and who it's for. And I think that's how we can all work together.
And we are here to do this.
That's what we're here for. That's that first panel we're going to talk about today. It's going to be about bridging the gap between healthcare and fitness, where we actually bring coaches, physicians, and registered dietitians together in this panel to talk about how
and I think that we need to educate and show the regular person, the people, and we need to educate doctors and health professionals. Because as I was in the past, one doctor that doesn't know anything about CrossFit and said fake news about it because I thought that it's only for athletes. Today I'm here to spread all other messages that I know and we do every day and save lives. I truly believe that nowadays I save more lives than before.
That's awesome. I think that's a great way to end this, which is amazing. So thank you so much for being on here with us.
It's an honor.
I look forward to the panel and then just having some more time to talk to you throughout the week here.
Of course.
Thank you. This is great.
You.
Awesome.
Thank you.